Hey Freedom Lovers, this is Dr. Peterson Pierre with America's Frontline Doctors bringing you today's Daily Dose. So the Office for National Statistics, ONS, has admitted in internal emails that it misclassified some vaccinated people who had died as unvaccinated in data sets used by the government to claim the COVID-19 jabs were safe and effective in 2021. In April of that year, the ONS, the government's regulator of statistics, began releasing monthly reports into mortality by vaccination status, more than 3 months after the rollout of the COVID-19 jabs began in January. The early reports appeared to show large spikes in non-COVID related deaths for unvaccinated people across the different age groups. Dr. Craig said this immediately raised questions for her because, quote, "There is no reason why the unvaccinated should suddenly die when you're vaccinated people," end quote. She and a group of statisticians and scientists, including Professors Norman Fenton and Martin Neal of Queen Mary University, London, have long questioned the validity of the data, pointing to various problems with record keeping and classification. The regulator claimed the apparent spike in deaths of the unvaccinated was because people close to death were not being vaccinated, otherwise known as the healthy vaccinee effect. But the regulator's claim contradicted NHS guidelines, which required critically ill people to be prioritized for the vaccine. Dr. Craig's subject access request revealed that the database on vaccinated people the ONS relied on had excluded those who had died before vaccine records had been sent back to the central system. She and her colleagues have been calling out the problem for years now. Quote, "We wrote papers showing that this was a record-keeping problem primarily. The ONS stuck to their guns and said that people who were just about to die were declining the jabs because there's no point them having it. They know they might die in 2 weeks' time. We've done all the math to show that this is not an adequate explanation, even if it's true in some cases," end quote, as she said. As well as claiming a healthy vaccinee effect, the ONS has also previously claimed an unhealthy vaccinee effect, whereby it said people with serious underlying health conditions were more likely to take the jabs as a way of explaining away death rates in the officially vaccinated. Mr. Fenton said, quote, "The ONS data, possibly more so than any other source of data in the world, was used to bolster the claim that the vaccines were highly safe and effective." Quote, "And, as we have always argued, and which is now certain, any claims of efficacy and safety based on their data were completely illusionary and subject to the cheap trick of miscategorization, whereby even a placebo, or something even worse, could be shown to be safe and effective. They therefore lied and intentionally created and spread misinformation," end quote. Wait, what? The government spreading misinformation? While they're busy labeling all the truth tellers as spreading misinformation. No, tell me that's not true. That can't possibly be. I thought the government made decisions that were in our best interests. Ladies and gentlemen, only the truth will set you free. Not lies, not misinformation, not disinformation, not fantasy. Stay tuned for the next Daily Dose.